Hello, and happy Vasculitis Awareness Month. Welcome to the Vasculitis Foundation webinar on improving doctor-patient communication. My name is Amir Hussain, and I am a medical student at the University of Chicago. Right off the bat, I wanted to clarify that I am no expert on doctor-patient communication, given that I am still in school. However, during my rotations, I have noticed how different doctors communicate with patients, and various issues that might come up. I have worked with the Vasculitis Foundation Young Adults Group to record 3 simulated conversations between a doctor and a patient. Each case was written to highlight specific positives or negatives about common interactions. Our goal is to use these cases as learning tools and to empower both patients and providers to use better communication techniques with each other. We are very interested in hearing your thoughts on these conversations. For example, listen how the doctor asks certain questions and how the patient responds. Think about what changes might have made the conversation more productive. Have you experienced similar conversations in your life? Please listen to these case studies and comment with your thoughts. Thank you. Good morning, Ms. Smith. I see that you just moved to this city and are looking for a new doctor. It is nice to meet you. My name is Dr. Jones.
Yes, that's correct. It's nice to meet you as well. You can call me Mary.
Okay, Mary, I'll need to ask some questions about your health. So do you have any medical problems?
Yes, I was diagnosed with vasculitis in 2004.
Okay, so what type of vasculitis is that? Who diagnosed it? What symptoms did you have? And were you ever in the hospital?
Well, that's a lot of questions. Let me think. Okay, I had some shortness of breath and I had a skin rash, so I went to see my primary care doctor. She ran a bunch of tests and sent me to a rheumatologist and then to a pulmonologist who took a biopsy of my lung. They thought it was Wegener's granulomatosis. Then I went to the hospital for a few days, and I'm not really sure what medications I received. Anyway, then I moved to
Okay,
Colorado.
that's all fine. So do you take any medications? Do you drink? Do you smoke? And do you take any drugs?
Well, I take rituximab and prednisone to control the vasculitis. I also take albuterol for my asthma. I don't smoke. I'm sorry, I forgot what else you asked.
That's okay. Let me see what else I have. Okay, have you ever been pregnant? Do you have regular periods? Have you ever had an STD?
What? I'm not. Why? I'm not sure why I need to answer that. Are you listening to what I'm telling you? Those questions don't make any sense.
Sorry, we need all this for documentation purposes, and we're running out of time here. So I can just get the rest of the information from your chart, and I'll talk to the rheumatologist, and we'll see what we can do next.
Wait, that's it? What doctor do you need to talk to? What do you want me to do? Should I keep taking my current medications?
Yeah, just do that for now, and then just call me or your rheumatologist if you have any questions. Good morning, Ms. Stevens. My name is Dr. Jones, and I'll be taking care of you today. Can you tell me what brought you in?
Hi, doctor. You can call me Julie. For the past year, I've been really tired all the time. I get muscle pains at random times during the day, and I haven't been able to sleep.
I'm sorry to hear that. Do you have any other medical problems?
I haven't been diagnosed with anything. Come to think of it, I also haven't been eating much. I lost about 20 pounds this year without even trying, and sometimes I wake up drenched in sweat. I often get headaches, too.
Have you been stressed a lot?
I'm stressed because I don't know what's going on. I've never been someone who gets stressed easily, but these symptoms have been going on for over a year, and that's making...
Okay, well, if you're anxious and you don't sleep or eat very well, that might explain the weight loss that you're having.
My last 2 doctors thought I had anxiety, but I still have all these symptoms after trying a few different medications. I really think something else is going on.
Okay, so I will run a few tests and get back to you soon.
Okay, what do you think it is? Is it bad? Am I going to be okay?
We don't really have much information at this point. I need to talk to a few other specialists and look at your lab results before I say anything. So I'll see you back in about 2 weeks.
All right, thank you.
Hi, Doc. Nothing new in the past month. Do you got any good news for me?
I do. Based on your results, it looks like your vasculitis has been in remission for 3 months. Congratulations.
That's great. Thanks.
I have better news. The FDA approved this new drug, Drug X, for maintenance of remission. Are you interested in hearing about it?
Yes, definitely.
So it blocks this new T cell receptor, and the studies say that you only have to take it one injection every 3 months. And this is way more convenient than the once per week thing you have currently.
Well, that sounds great.
Yeah, it is. The only side effects are muscle spasms and arthritis to low level exercise. So how does that sound?
Honestly, not so good. I recently started athletic training, and I plan on doing a decathlon very soon. I probably won't stick to the low exercise part of that, or the low exercise thing, you know?
All right. Well, thanks for telling me. The decathlon sounds like a great thing, which I definitely could not do. So let me see what other treatment options we have. Okay, so we have drug Y that was approved a few years ago for your form of vasculitis. It suppresses the immune system by a decent amount, so you'll need to come in every 2 weeks for blood work.
But what about exercise?
It doesn't have any risks in that department, so there's no problem with dehydration, muscle pain, or delayed healing. But the blood work gets pretty annoying, so you have to come for regular checkups.
I can do the blood work and checkups. The exercise plan is the most important thing to me. So I'll go with drug Y if it means that I can still train.
Okay, great. Sounds like a plan. So I'll start you on drug Y. So take that as a pill 3 times per day, and then I'll see you back in 2 weeks for the first round of blood work.
But thanks, Doc. See you later.